We do have an agenda. If folks saw that, we just need to approve that agenda or talk about any additions. And I mean, I don't mind, Ray, like just adding a public comment after we come out of executive session.
Exactly.
Then if there is the public here, then we absolutely could take public comment.
I think Kyle said that this meeting doesn't warrant an executive session.
That's correct.
Right.
Oh,
So we
this
could
could be a
remove
public
that.
meeting.
Yeah.
Oh, okay. So on the agenda, there is new business, and then number 4, move to executive session, actually needs to be removed.
Motion to remove item 4.
Wait, the agenda hasn't been approved yet. So what you can
Right.
do is you can discuss what you're doing for it. And then when you agree upon the final agenda, then you would move to approve it. So
Okay,
With the amendments.
say that again. What was the last comment, Kyle?
So,
Uh,
my,
The
well,
my comment is
just discuss what the changes are. And then when you're clear on the changes, somebody would make a motion to approve the agenda as amended.
Okay.
Because it hasn't been approved yet. So you don't need to do a motion to withdraw or anything. Does that make sense?
Okay. Yep.
Okay.
So it sounds like we can go through the new business. After new business, we could have public comment. If somebody from the public comes, we can remove the executive session and then adjourn. Does that sound about right?
correct. I move to adopt the agenda, removing item number 4, executive session, replacing item number 4 with public comment, should any public be at the meeting.
Thank you, Troy.
I second the motion.
Thank you, Patty. Do we need to do roll call, Kyle, for approval? This is Amy Ashton Williams. Aye.
Patty Farr, aye.
Olivia Borman, aye.
Troy Castalis, aye.
Can Nikki come off mute?
Oh, Nicole Pantley, aye.
Thank you. Okay, agenda is approved. And so, Ray.
I am
It's yours.
having difficulties here on my computer. That's awesome. Anyway, okay. So I'll fill you all in on what I know. Basically, the reason this is informative. So the reason I called the meeting was to let you all know what I received from the Talent Council. I want to be completely transparent in that I don't speak for the Talent Council. I'm not a part of the Talent Council. All I'm doing is repeating or reporting to you all what I understand as communications from the Talent Council. I sent in an email a link to their website so that you all can take a look and see who's there. They do have a meeting for tomorrow if you all are interested in attending. But the short version is they made an announcement that they are presenting a legislative concept to make the Board of Licensed Social Workers fall under the verbiage that they used is the administrative umbrella of the Mental Health Regulation Agency or regulatory agency. And can you all still hear me? Because there it is. Okay. Wow. Can you all let me know if you all can still hear me? Because my computer is acting really weird. Okay, awesome. Okay. And so I guess as far as what that would mean to you all, I brought Kyle here. There's a couple of I guess piece of information that I want you all to understand. So there's the legal parts of it that Kyle can speak to, and then there's the policy / daily running of the board that are the implications. So I'm going to be quiet because Kyle only has 30 minutes and let Kyle speak to kind of what that means from his perspective. So.
Sure. And let me preface this that the only thing I've reviewed is what is in box that you reviewed. And so they indicate in box there's this talks about LC 216, but there is actually, that I didn't see any actual legislative concept there, which a legislative concept would normally be, it would have proposed like what you would see in a bill to changes to the statute. Right now, the Board of Licensed Social Work is a separate standalone agency within the state of Oregon. It is created by statute. It is subject to the authority that is allowed by statute. And so what is being proposed here is what was essentially, my understanding was proposed, I can't remember when, but back when MHRA, and MHRA is a mental health regulatory agency, and it functions as the administrative support agency for the boards of psychology and the boards of licensed and professional counselors. And basically what that means is it employs all the workers that handle all the support and work for those boards. In other words, the psych board and the LPCT board does not employ them. They're employed through MHRA. And the executive director for MHRA is the executive director for each of those boards. Those boards function independently, so it doesn't change what their regulatory structure is by statute. It doesn't change how they regulate the profession. It doesn't change, what sort of policies they have regarding the profession, what sort of rules they have. Those are all still controlled by the boards. It does change to a certain extent that the executive director, because the executive director of MHRA is the executive director of those boards. And the statute provides that the boards have basically, those two boards have joint authority to hire an executive director. And if they can't agree, I believe the statutes say that the governor's office then makes the decision. So if the legislative concept, the actual language to change the statutes were to be similar to what is the psychologist board and the licensed professional counselors and therapists board, it wouldn't change the board's independent regulatory authority and how it essentially regulates the profession from a legal standpoint. It would change it from a policy standpoint, from how, the work is done, because it would be done by the workers and employees of MHRA, not of the board directly themselves. So that's what I can speak to from a legal standpoint. There's obviously, it's a policy decision as to whether to do this. And, to do this, it would require a statutory change, which means it would have to go through the legislative process. And whoever sponsors the legislation ends up initially framing how the legislation goes. And that goes through legislative council. And then, the boards obviously can have some input, but that would be controlled obviously by how the governor's office approaches it, because state agencies, unless you're a publicly elected official agency, they have to go through the governor's office when it comes to legislation and how the state takes an approach to that. So any questions about that?
How would the contracts work with our current staff and
Contracts,
executive
what do you
director?
mean?
Like for instance, for like a union contract, like there are like recall rights and also like bumping rights that a person has, where they be moved.
Yeah, and unfortunately, I'm not a labor and employment. And so that would have to be something. We have a labor and employment section at Department of Justice that handles all of that. And that's something that I would have to engage our folks in that section on. My recollection is when MHR was created and basically the staff for Psych Board and LPCT Board, they were transitioned over to be staff of MHRA. But honestly, I don't know how that was done, and I was not involved in it. But that's a good question. I certainly could engage our L&E folks and find out. But first, I would suggest you ask DAS, because DAS is the one that does all the HR functions for the state, and they would be the initial go-to for the board for that purpose. And then they would come over to DOJ if they needed legal advice about how that would function within the existing SEIU contract and other contracts like AFSCME, to the extent that it applies.
our office isn't represented, right?
I'm sorry?
Our office is not represented.
I don't know that. I would think
No.
they are. I mean,
We're not represented.
No, the
They're
Board of
not?
Licensed Social
Okay.
Work is not represented.
Okay. Well, then that means it wouldn't apply, the SEIU contract.
Mm-hmm. There's probably another contract though, right? Because you all have to have some kind of.
No, the SEIU is the main contract that normally applies. There might be ASME, which applies to some professional, but I doubt it would be the board employees here.
So, and I don't know if this is a Kyle question or a Ray question, but I just like, I don't understand the point of this. So I'm struggling to understand, like, it sounds like there wouldn't be a legal impact, but then there's the piece about is Ray wouldn't be our executive director because the executive director is of Mahura, MHRA, whatever, is of them. And I just like, I don't get it. And I guess maybe that's part of what the meeting is about, but yeah, I don't understand why the Board of Licensed Social Workers would be taken under this. I don't know what problem they're trying to solve by doing that.
Mhm,
And so
exactly.
I might have more legal, like, logistic-y questions, but right now, I just, like, I don't even understand why this is, what problem this is supposed to, I hear, like, you know, lots of people need care, but I don't know how this solves that problem. So I guess
and
just
that's a
stating
Ray
that, that's
question.
kind of where I'm at.
Yeah, exactly.
That's
So
a policy
and-
question.
Right. And so I was going to kind of speak to some of that. But before I do that, I want to make sure that if you all have any questions for Kyle, you get those answered because Kyle has a hard stop at 3:30. So do you all have any additional questions for Kyle from the legal perspective, from the legal part of this?
So what I'm hearing Kyle say is like our role on the board would remain and all of our positions on the board would remain, but our office everybody in our office may lose their jobs if this goes through.
Well, what would happen is that the board, yes, you would remain, the board remains, the board's function, the board's role, assuming there's no other changes to the statutes. But the office workers and everything would not be board employees under the state system. They would be MHRA employees.
And would they get transferred over? Or are we now in the legal counsel question?
Well, I don't know that that's a legal counsel question or that's a DAS HR question. I mean, I'd start with, I would start with a DAS HR question first. Nicole, Nikki?
Yeah, so that was, I wanted clarification on that. So again, it sounds like board functions would be the same as they are in statute. What would happen is who is overseeing and doing our administrative function would transfer to MHARA. And I understand what they're trying to do because if you read that massive report, it's all about streamlining licensing and all of that great stuff that they talk about. What I'm just curious about is when this decision was made, like, why wasn't like while this was being developed, there was a lot of people brought to the table in this. Why was nobody from the Board of Licensed Social Worker brought to the table on this at all during this workforce group? And that this report is quite robust. And, you know, Ray, it may have taken you 15 minutes to read it. It took me far longer than that to read it. How does that happen?
It just did.
Okay.
So yeah,
and that may not be a question for you, Kyle. I'm sorry.
I can't answer that. I mean,
yeah.
I mean, I'm not involved with this council. And the first I heard of it was when Ray reached out to me about attending this meeting a few days ago. So it's not something I'm directly involved in at all. And I don't know if there's anyone from DOJ. But nobody reached out to me, and I wouldn't normally be involved if it's not one of the agencies that we work with for my section.
Okay. And I'm going to answer that one too. Well, I shouldn't say I can't. I'm going to say the information I have that addresses that concern, Nikki. But before I start talking, any more questions for Kyle?
So that my suggestion is the legislative concept is supposed to drop on Friday. That's the due date for for the February session. Is that we may want to tentatively schedule a meeting on the other side of actually seeing the language, because there should be a lot more detail about the transition, the transfer, what other statutes are changed, what from the personnel's point of view is going to change, what from a policy point of view should change or could change being proposed, because the legislature can still modify it once they come into being. It's just the legislative concept's a starting point for a discussion. We might want to look at holding a call, which may end up actually having an executive session in it, because it may deal with employment related matters that are subject to and can be part of the executive session statute allowance to drop into that. But I can tell you I've been involved in 3 or 4 transitions where been in an agency that got moved in, and also have had a situation where agency moved into an area that I was responsible for, and every one of them was treated very differently. The level of detail in the bill, sometimes very sparse, sometimes very, very detailed, down to position numbers and talking about what happens or doesn't happen, what happens to incumbents or not, what happens to board members or not. It's a little difficult right now, other than having the topical paper and discussion that's out there, without actually seeing what, at least initially, is being proposed for the legislature to consider with any sense of detail, because there will also come with it an implementation plan that somebody's going to be responsible for doing, whether that's STAS or MHRA, if I get the acronym correctly, sorry. But somebody's got to put an implementation plan together too, and the timeline and all the relevant pieces to it. So it's a difficult spot to be in, because you're aware of something, but there's not really a lot to grab onto yet as far as the actual technical answers and instructions of what's at least going to be debated.
Yeah, and I agree with Troy. That was, if we don't get anything. I mean, I was hoping to. I want to give you all the information that I have, which is not much. But the goal of this was to determine. I do want to make sure that we're determining whether or not we want to meet after that LC drops, like Troy says. And I think if we don't get anything else done today, we should get that done. All right. So with that said, I'm going to assume that there's not any more questions for Kyle. If you do have questions for Kyle, please just cut me off and start because Kyle's going to be out here at 3:30, and I want to make sure that you all have the information that you need. So as I stated before, I sent that. So I want to be clear. As I stated, I'm not a member of the Behavioral Health Talent Council. I didn't attend those meetings. I found this out because the governor's policy advisor informed me that it would be a wise idea to attend that meeting. She also, I mean, there has been some discussion around it, but as far as an LC, that's something I wasn't part of. I didn't have any part of those discussions. The only thing I'm doing today, go ahead.
LC is legislative concept.
Yes. Okay. So I guess let's talk about
nodding
that.
like I understood, but wanted to
Right.
check.
So let's talk about the process. So as it stands right now, the information I got was that the Behavioral Health Talent Council is working, I don't know, and I don't even have those specifics, to create what's called an LC. An LC, I believe, and Kyle can correct me on it, it's what's called a legislative concept. And so someone, I believe, from the what do I have here? Anyway, there's someone at an office that writes that legislative concept into a bill. And then that bill goes before the legislature, and then they start the legislative process with that bill. So right now, like Troy stated, I don't have information on the specifics of what they're going to propose, because the LC is not a bill. It's just a concept as it stands right now that someone is writing. Okay, so I'm going to stop there. Does anyone have any questions just on that? The process itself. Okay. And then my goal is just to give you all the information that I have, because, I don't want, if I have it it would make sense for you to have it too. I'm not gonna have you all be blindsided by this the same way I was. Okay, so anyway, the Talent Council is an advisory council, and they're exempt from public meetings law because they report directly to the governor. So that will probably be one of the reasons, I don't know why, but anyway, what I do know is the fact of the matter is, since the Talent Council reports to an individual, in this case, the individual being a governor, they're exempt from public meetings law. As far as the why, in those documents, the Talent Council speaks to the why. I don't have any data on the why. I can't confirm any benefit from a move. So you all can read their documentation. I'm not going to stand behind their documentation because I didn't create it. I didn't affirm it. I didn't confirm it. It's just a bunch of stuff that they wrote, and they're making actions based on what they see in those documents. If you have any questions on those documents and what data they have to the effectiveness, that will be something you want to talk to the Talent Council about. As far as benefit, the Talent Council would have whatever documentation they have on the benefit of this. In order for me to make any analysis as to whether or not there's any effectiveness to it, I'd have to do a cost benefit analysis. I'd have to do some type of a benefit statement as to what the outcome is. I'd have to create a plan, and I wasn't asked to do any of that. And so if that's been done on the Talent Council side, that would be a question to ask them as to what documentation they have, that there's a benefit to the move. I can't speak to that either. What I can speak to is, so the Board of Licensed Social Workers has two highly important actions that needs to be taken immediately before even thinking about doing anything else. I don't care what the anything else is. Number one, I'm working with our staff to get this to get the RAC taken care of so that we can do a fee increase. So the fact of the matter is, we simply don't have the staff to do a merger and a fee increase at the same time, no matter what legislation is written. And if we don't get that fee increase done, we're looking at not being able to even accomplish our primary mission. So there's something that's kind of important there. The other thing is figuring out what to do with Thintia. So Thintia is in receivership. That's comparable in the United States to a bankruptcy. And I don't know what the future of Thintia is, but I know we can't get out of Thintia until so the legislature hasn't given us funds to buy a new licensing system. We don't have enough reserve, and I can talk more about that later. It's hard. I guess the fact of the matter is we don't have the money that would allow the legislature to allocate us towards getting a licensing system, and that's not going to happen until the fee increase. So we've got the fee increase that puts us at substantial risk, and we've got the licensing system that places us at substantial risk. And now they're talking about a merger, and we barely have the staff to support the two things that I just discussed. Those are facts. All right. And that's really all I have on this. And all that's left is for you all to have a discussion, for you all to ask questions. It looks like Kyle might have left. And then I would strongly recommend, as Troy stated, once this LC drops, and Troy, once it drops, it becomes a bill. Is that correct?
Not yet. It stays as a legislative concept. We'll get a legislative concept number. And then when either the Speaker of the House or the Senate President, whichever way that concept gets directed, it's then up to the leadership of either of those chambers to then it comes in, and that's administratively when a bill number gets assigned, either Senate Bill XYZ or House Bill XYZ.
Well, let me ask this question.
Yep.
So my understanding is there's no requirement that those who are initiating the legislative concept has to share that with anybody, right? I mean, the bill is public information, but my understanding is the legislative concept is not. I'm sorry, go ahead, Troy.
Nope, that you're spot on. Great point.
Okay.
Legislative concept is basically attorney-client privilege. It's the lawyers for the legislature that are working with somebody that's sponsoring it to craft the language of what would be looked at as a bill, what law would change or edit or be added. So it's up to the sponsor, not the lawyer, the sponsor to say, yes, I'm willing to make this public. But technically it does not see the views of other eyeballs until there's actually a Senate bill or a House bill assigned to that concept that's been accepted by the legislature to be heard. Did that make sense?
Oh, absolutely. Yeah. Well, that's the board. I'm sorry, board members.
No, I mean, that's why I guess I'm unfazed, because I've just seen a lot of legislative concepts go nowhere because it's just a concept and it can become a bill. But as we know, last year there was 3,000 plus bills and almost all of them died. So again, I think we have a lot of we have time. We have time, and we'll have the opportunity to do some analysis of the bill, whichever bill that ends up, because it might end up being multiple bills in multiple different
Right, exactly.
places, right? But being able to do an analysis of that. But by that time, like that, well, hopefully, Troy, or for those of us that have analyzed bills, sometimes they're super detailed. Other times, like it's 2 sentences and you're like, I mean, I can analyze the bill, but y'all didn't give us much.
So and I also, I'm sorry, go ahead.
Yep, go ahead.
So I also, I apologize. There's another piece of information. My understanding is this is part of an entire series of concepts that the governor is going to be introducing. So I can think of at least 3 others, and I'm not supposed to share them. But this is the one, that I guess that affects the board, impacts the board. But yeah, you're right, Amy. There's gonna, my understanding is there's a possibility that there's going to be a bill with lots of different language in it. This is just one part of the language that's going to be in that total bill. Does that make sense? Or that could be, I'll say that, in that total bill. Well, but I mean, so Troy, once again, I'm sorry, I'm all new, and I'm going to put you on the spot if I say something and this is not the place to have that discussion, then simply let me know. But as far as the LC goes, it can be a bunch of different things, right? When it becomes a bill, right?
Oregon has, and I'm only talking process. Oregon has
Right, we're only talking process, right?
Yeah, Oregon has what's called a relating clause requirement. So the very first 7 or 8 words, typically the very, very start of the whole bill, it says related to something. Now, everything that follows on from there must fall under that umbrella. The relating to clause is what establishes how wide, very broad, or how very narrow a bill could be. So if they say something related to mental health services, that's a very broad statement, and there's a whole bunch of things that can be packed in there. If it comes down as related to a very specific thing, then the only item that could be underneath that follows it is related to that particular little niche thing that's identified. And it's not ours to worry about. There are lawyers, the legislative, the council for the legislature is watching that. The sergeant at arms on both chambers are watching for that to make sure nothing gets added or changed that's out of bounds. But I will go back real quick to Amy, your point. While there may be 3,000 plus bills that were heard and only hundreds of them actually passed, there were more than 3,000 legislative concepts. It's even a bigger pool. There were thousands and thousands of legislative concepts that became, and only the ones that were adopted and accepted to be even talked about were 3,000 bills. Of the 3,000 bills, only a couple hundred actually even passed. So the filtering is massive percentages of what happens as it drops down to actually being something that is passed out of the legislature, and then it's considered by whether the governor wants to sign it or not. The governor could veto it. It stops there too. So, but process-wise, it's just hard to think about what this means and what's happening without seeing the actual language, whether that's in a concept form or that's in bill form. at some point in time.
And the Behavioral Health Talent Council advises the governor. So just so you all are clear on that. So, and then as far as what I know, I've given you all most of the documentation that I've given you all the documentation that I can share that's part of this issue. There's only a couple things that I've been asked not to share, but you know, as far as what's important for today's meeting, those wouldn't really matter for today's meeting. So, because this is simply informative.
Was there anything else, Ray?
I
I
don't
was
really
just
have
looking
anything
at
else.
new business and I was like, I think, no.
Let me look at it. Yeah, my computer is acting stupid. So, but no, I don't have anything else. This is the new business. So,
What? So Friday, will it be on Olus, Troy? Do we know? Will it be on Olus by Friday, in a Friday?
I don't know
Okay.
because if it's a concept form, as I mentioned earlier, the sponsor or sponsors plural don't have to share it publicly until it comes across the speaker or the president's desk and gets a bill number assigned. OLIS, my understanding is is when it's got a bill number assigned.
Right.
Mhm.
Concepts are pre-OLIS. And OLIS is the Oregon Legislative Information System where they track the history and how bills are moving and where they've been assigned. On the for the legislative as the third branch of government, what's going on for their work. So I want to say I don't think it'll be an OLIS until there's a bill number, but I've also not gone in and looked at the legislative information system for 4 years.
What time? Do we know what time the meeting is tomorrow?
let me put. Well, my
It's
stuff's
at
not
2
working.
o'clock.
There we go. Thank you.
It's at 2 o'clock. Okay. I hope I can make that.
And it is, I mean, again, Ray, I did not know, like, they did not have to have it be, so they've been having meetings outside of these public meetings that they
Yes.
have. They've
Well,
had
let
these
me take a
meetings.
step back. I don't know. I can't speak to that.
Well, it's just interesting because I went back and read their public meeting minutes, and there's no mention of this in any of those minutes. So when I heard about it was at the last public meeting that they had. And that was like, oh, and we're going to have this legislative concept. So then I was like, oh, I need to go
Mhm.
back and look at the notes from the previous meetings to be like, this was discussed and how was this discussed? But it was not. So now it's out there.
Yeah, I'm on their website, and when you first sent this for the December meeting, I was like, there's so many things to go through. Like, I don't even know what to focus on in like this limited amount of time that I have to try to like understand what's happening. And yeah, it sounds like we'll get more information when this LC, if and when we get to see whatever whatever draft, whatever version of this thing is. I guess I just feel frustrated. Like I'm just so confused. Like if one of their major things is that this board would become under this thing, like why weren't we talked to as a board? And like is there even any space for and like maybe it's, I don't know, innocent, like I don't know, but it feels shady the way it was done. So like I feel like a lot of like hairs raised, and I don't know if I like need to be, you know, guarded or like defensive against it, but the way that it's come about is really just confusing how that's happened. So yeah, I guess I just like I don't know what to do with that. And I don't necessarily need an answer from y'all, but yeah, just naming that that's kind of where I'm feeling stuck or like confused right now. On top of not having details of like what this what this is or like how this is supposed to help.
Yeah, you all have the same details I have, with the
Yeah.
exception of a couple of documents that won't, for what we're doing, it won't affect things one way or the other.
Well, according to their document, right, they're trying to improve licensing consistency, modernize regulation, right, strengthen consumer protection pathways. So they
What does
think
that
by,
mean?
yeah.
What does that
So-
mean? Those are just words. What do you
So-
mean?
Because there are 16 licensing boards? There's 16 licensing boards, and there's like 60 credentials in Oregon in the behavioral health field. And so like as I was reading through all of this stuff, and I'm just going off of what I was reading. I'm not saying
Yeah,
any
no,
of
I
it will
appreciate
do
it,
it.
Nicole or
What I'm
Nikki.
saying is that seems like that is what they're trying to deliver on us, that we're going to move this all under the mental health MHRA umbrella to streamline the processes, because one of the problems is getting people licensed. It's too confusing for people. And that report talks about the confusion of licensing. It talks about how difficult career pathways are. It talks about how many people have like, as far as people going into community colleges and universities for mental health, like how much that has dropped along with burnout. It's a very robust document. And the only thing
I think
I
I'm
can,
missing that document.
thing
I only
I'm-
see this
Well-
2-page document.
it's
Oh,
in the
what?
link. There's a link on there
Well,
that has the assessment.
Yeah. so let me jump in here. So,
Oh, okay.
well, let me jump in. So I have only been focused on the information that concerns the Board of Licensed Social Workers. Nikki, you are correct. There's a lot of information that they have that has nothing to do with us. Okay. So when you sort through that information, what differentiates us from what a lot of the other information that's in that report is the Board of Licensed Social Workers works with people who are licensees. So that's important. Not people who have certifications, not people who have, something other than that. So they're working only with this part of that stuff that deals with us is only for licensees. And then our population have master's degrees and have passed a test in order to enjoy the privilege of having a license in the state of Oregon. Now, they've got MACBO on there. That doesn't do that. They've got traditional health workers on there that don't do that. I think they've got CNAs as part of that don't do that. And so I guess that's I didn't even think about that. I did have a chance to look at that documentation and kind of glean through, take out what doesn't apply to us and talk about what does apply to us. But the reason I'm saying that is because if you look at all of that information and then you only look at the information that applies specifically to licensing boards, and then within that information for licensing boards and mental health, you'll find there's really only two boards that they can talk about. The Board of Licensed Social Workers and MHRA. And so I guess to the point, if they have 20 documents as part of what they're doing, a half of one of those would apply to us. And so when you look through that stuff, be careful about, you don't want to go down, and I apologize. I didn't think about it because I did that. I actually did the process of looking at what's there and saying, out of what you are talking about, what of this applies to licensed social workers? Oh, MACBO, that's not us. Traditional health workers, that's not us. CNAs, that's not us. And when you take all of that stuff out, you'll find a very small percentage of that applies to us. Now, the other thing I want to point out is right now, we're doing 15-day turnaround times on licenses. I've committed to 30 because we don't have the staff we need. But we're doing 15-day turnaround on licenses. We're doing 24 hour on callbacks, and we're doing 24 hours on email responses. Now, I guess that's problematic. It could be. I'm not sure. But that's the fact. Those are the facts of how we're performing right now.
That was another thing that was confusing me, because the the high level piece of that, oh, where did it go? So many tabs open. And yeah, the like, oh, it's confusing and da-da-da. I'm like, is it confusing? Like, doesn't your program tell you what you need to do to become licensed? Or like, isn't that part of it? And
Well,
where is that?
so I will readily admit that if you go to our website can use some updating. And we do regularly get questions on the licensure process. The question is, what's the most effective way to fix that? You give me one staff in 2 months and I'll fix that.
Yeah.
No problem. Okay.
Yeah, I'm like the only benefit in the like 2-page document, this like streamlining credentialing, we are not at a long delay anymore. Like historically, yeah, it took a long time, but it is not anymore. And how does it become more efficient for OHA to adopt a centralized credentialing process versus us? I was like, do you have something that is not Thentia that we get to use now? Because like, what does the LMFT and psychology boards, like what are they using? Are you giving us resources that will now get to be better, or are you making things more difficult? Administrative burden, I don't know how we have more administrative burden. We just need money to do the work, to pay the people to do the work. Like, yeah, I remain confused. I don't think is the right word. I remain skeptical. I don't know.
Do we know how we compare to the other boards?
Ooh.
I looked.
I have
Go
like
ahead.
anecdotal.
Yeah, go ahead, Nikki.
I said I tried to take a look because one of the things is that if you don't read that whole report, which I did read the whole report, if you read what applies to us, it clearly talks about streamlining and standardizing licensor requirements, right?
Absolutely.
As a problem. It says in this report, in different words, I'm going to use my simple ones, that it's slow, confusing, inconsistent, expenses, and there's many different boards. Their recommendation in this is to simplify and align the system, right? So they think by probably putting it under one umbrella, this is going to happen. And they give examples in the report from Washington State, their licensing reciprocity, Utah, that's removing unnecessary barriers, Massachusetts. So there's a lot of stuff that they do in there. But I was curious. I was like, well, MH, how big is this? How many people do they oversee? And when I tried to get a number of like LPC and psychologists, because they do have people with licenses who are certified underneath there, it seemed like it was about like under 3,000 that I could figure out that they handle. So I'm like, how are they going to take on 10,000? Because we're over 10,000, right?
We're close to 10,000.
Yeah, we're close to 10,000. So I was kind of like, I mean, because I like stepping back away from this board and just going, okay, let's look at this from an operational standpoint. Being under one thing could make sense, right? But then like, I worry about like, are they capable of doing this? I think this is all farther down the line, as we spoke about, that this could die. This could just die on the stand, right? We don't even know. But like, and that was what I could gather off the internet. It was really hard to find actually how many licenses they had. But what I could see was like, it was like under 3,000, I think.
So Nikki, when you read that, did you, because I haven't looked, I'm buried. Did you see anything in there? And I'm just asking the question that makes the leap from operating in the way that we operate now to operating with the administrative functions under another board is going to immediately make some type of a difference. Did you see that in there anywhere?
It talks about wanting to reduce duplication. It talks about wanting to shorten licensure time, right? And make career, I think they use the word mobility easier, because it's getting people licensed, having them ready to go. So I think that like in my notes, that's, I was looking at, and there's a lot of contradictory stuff, because they're like, hey, we want to, on page 7, it says, we're not going to make this a one size fits all project, but yet It does, right? And it says that we convened a steering committee composed of behavioral health workforce stakeholders. Well, okay, you know, and so there's some stuff, but that's what I could get out of it. And I only started reading this about 3 hours ago, right? And literally, like, it takes me, I am behind in most of you in education. So it takes me much longer to read, understand, and distill these concepts. And I got to page like, I think 78 is where I got.
Yeah,
So.
okay. So yeah, you read
Because
the
I was
full
like
report,
15
yeah.
minutes. I'm like, I am really behind. I'm like, oh, I don't think that anybody could read this. in
Yeah,
15
no,
minutes.
not the big. And if I sent you all the big report and told you 15 minutes, I completely apologize for that. There was a 2-pager, and that's what I intended to be
Yeah.
15 minutes.
Yeah.
Did you all get the big report too?
Mhm.
Did I send that? I
Yeah,
did
it's a
send it.
link.
I
It's
apologize.
linked
a
in
link
the
at the bottom.
2-pager.
Mhm.
It's
It's a
linked in the
link to the
2-pager.
2-pager or from the 2-pager?
From the
From.
2-pager.
Yeah, okay, now that's and you're right, that's the full report. And it would be wise to look at that full report, but I would still, it wouldn't be a bad idea to see in that report where the leap from Board of Licensed Social Workers today and then Board of Licensed Social Workers under the administrative of umbrella MHRA is, how is that gonna change to who? And maybe it's there. I read that full report and I didn't see that. So but maybe it's there. I can't speak to that. That's the talent council. That's what they do. I don't do that. I operate the board. So that's out of my scope. So but I think it's 3:52. So I think it might be a good idea. You all are board members, so you all decide if I think number one, it'd be a good idea to schedule something after when we think a legislative concept might actually be a bill in a public document that we could discuss and setting that up as another special meeting if you all want to do that. And then yeah, so I think that would be a wise idea. And then maybe even, because honestly, those actions come out of that report. To be transparent, is my understanding. Once again, I'm not going to speak for the talent council, but my understanding is they're at least using that as a resource of some type. And so, being able to take a look at that and see, maybe you'll find a why. I'm not sure. So that might be helpful. So
And-
thoughts
and-
on I'm sorry, go ahead. Nikki.
In reading it, like, and I don't know, somebody else can go back and in reading it, but like in reading it, the leap to like combine these boards doesn't look like it came from a single dramatic moment. It looks like they've identified structural gaps that have existed since the creation, and so they're trying to put it together. I could be wrong on that, but that's
Yeah, I don't
just
know.
kind of one way I read it. So, and again, they're trying to reduce this duplication, the licensing process. This report also repeats itself quite a bit. Molly, I saw your hand was up.
Oh, Molly, I'm sorry.
Yeah, sorry, I was taking care of my mom and things can be unpredictable in that regard. So I agree. I think there's a vagueness. I think Olivia is where I'm at with some of these statements when I see like doing this is going to streamline. To me, that's government speak for absolutely nothing concrete, like that always makes me nervous. Like all it is going to be a different form of bureaucracy. That's my concern. And it was really concerning and a little frustrating to see there be a reference to the delay that is no longer in existence, and that the staff for this board in particular have worked so hard to overcome and like sustain. So that was like super frustrating, made me wonder where that narrative was coming from. I guess I'm curious if you have had any conversation with them, right? And maybe you can connect afterwards if you've already talked about that. To me, this is, I don't know exactly where it's coming from, but this is, and I've heard this off and on over the years, the big red flag for me is the push. Like they've never, like counseling in particular, LPC, have never liked that we don't let them supervise social workers all the way through licensure. And that was one of the things they talked about in that 2-pager, was making it basically so that anyone with a license could supervise anyone towards a license, regardless. It didn't have to be social work. So I find that interesting that that's coming back up again.
So I want to speak directly to that one, which is I didn't really bring that up in this meeting, but Kim is here. I don't mean to put you on the spot, but we're running a rack right now, and I know in that rack we've already talked about adding professions to the group of people that can supervise social workers. Kim, and then I'm sorry, Kim, I don't mean to put you on the spot. If you don't have it, that's fine. But who are we adding already? And then what would that bring us to once we do that?
So we're adding LMFTs and LPCs for doing up to half of a CSWA supervision. The remaining half would still have to be done with an LCSW, but our rules already allow for half of a CSWA's supervision to be completed under a psychologist or a psychiatrist licensed in Oregon.
I read
So
this
that part of it,
two-page
we already
document.
got that covered. I'm sorry, go ahead.
I don't think so. I think that this 2-page document was about making it so that they could supervise for the entirety of somebody's.
Oh, okay.
And that's a concern to me, I'll be honest, as someone who's supervised multiple degrees towards licensure. Like, there's such a gap around, I'm going to call it a gap, maybe they would be offended by that. For other degrees, they do not talk about social justice, they don't talk about advocacy. There's a huge thing, and that, so I will die on that mountain around, like, social workers need to supervise social workers at least half their hours in the state of Oregon. Because I've had licensee or CSW versions of CSWAs who are not social workers literally look me in the eye and tell me that the advocacy is not a part of their job, you know, as a counselor. I didn't even know what to say. I'm like, I got nothing for you on that. Like your job is not to advocate for your client. Like, what the? So, like, and I did read that. Maybe I misread it, but I interpreted it to mean like that is their way to streamline because there's not enough supervisors in the state, which I also haven't necessarily heard. There's maybe not enough of like BIPOC and queer folk, and I know there's a challenge in rural areas, but they can do it all remote too. So, but that's how I read it.
So, and in one of those documents that I sent you, I think there's a paragraph that speaks specifically that I don't have one. I can't get my computer to work, so I don't know which one it is. But in the way I read it, and maybe I was reading it incorrectly, but my recollection is the statement is something like the board does not allow those professions to supervise at all, which is not a correct statement.
One of the things that's super interesting in that larger report is they reference like we should do reciprocity, like Washington does reciprocity. We do. And I've been attempting to get my Washington license since August. It's now January. I still don't have my Washington license with their great reciprocity rules. So there's that. And there was another thing in the larger report that there's no talk of the benefits of a composite board, right? There's just they don't talk about the benefits of it. They're just talking about a streamlined process. And then the conclusion drawn is that a composite board will then solve the problem. And I do not see that as, that's what this board drew from that report was we'll do a composite board and that will somehow streamline. And so I would love to kind of hear how they came to that conclusion.
Yeah, Amy, I think the exact language on that is this bill brings the Board of Licensed Social Workers under MHRA to improve efficiency and customer service without raising cost.
So
and
right
this
now,
structure will lever current administrative capacity. That's their language.
So we license in 15 days. We have 24-hour turnaround time on emails, 24-hour turnaround time on telephone calls.
But I
So
do
is this
think,
something that we should do a written response to some of these of like, here's some actual
Yeah.
errors in your assessment? Like, because there's statements that we know are not true anymore, at least currently. And it seems like, I mean, is it our benefit to do a written response around here's the turnaround time, here's what reciprocity looks like for us and how fast we process those, and we prioritize Oregon licensees, and we already allow, ABC for half of their hours and we're about to approve others. Like, I'm just wondering if there should be some kind of response now around like, y'all got it wrong.
I would like that.
I
would
think
like
the
that.
other is looking at how we count days compared to how sorry,
Right.
y'all, I don't know their
MHRA.
thing.
Right.
How MHRA counts
Exactly.
days to
Yes.
licensure. Like, is it because the prospective licensee has all their documents in and it only takes them 1 day then to get them licensed? Where we're looking at from the time they start the whole process and then get fingerprinted and that are we not counting days in the same way? Because
No,
that
we're
we
not.
should get aligned.
Yeah, we are not counting days in the same way.
Or at least provide the context for the 15 days encompasses from this, right? And if someone's missing a document, of course, that will delay. But if we have everything in, this is what it looks like, because they're missing context for sure around that. And I was a little annoyed too to find here, like they referenced, which is the biggest challenge is not getting licensed, it's getting on insurance panels, which quite honestly, nobody in the state
Right.
has any control over anyway. So stop pretending like any of this is going to impact that, because that does take months and months and months.
But insurance, is that a barrier to licensure? Because we don't ask for insurance.
No, but what will happen is that even if I'm licensed, if I take a job like in a private practice setting, or an outpatient setting, if I'm not on those panels, they have to get me on those panels. And so I can't bill until then. And so I think that's even in hospital settings and things that maybe
But
like
what does
that.
that
I
have to do
know
with the
for
Board of
outpatient.
Licensed Social Workers?
Molly, my
Nothing.
understanding
Okay.
Molly, my understanding is that part of that LC is only related to CCOs. It's not related to private insurance, which OHA then could
Okay.
have some pull.
Okay. I
Yeah.
just feel like they're trying to lump everything in together and it's like apples and oranges, quite honestly. And that's super frustrating because let's face it, every single representative is not going to understand any of that if we don't clarify it now or try to get it clarified.
Yeah. And this is
And-
outside of the scope of work of our board and licensing and stuff, but behavioral health workforce crisis. Okay, why is there a behavioral health workforce crisis? Because there's not enough people for folks who need services. Why do so many people need services? What could solve some of those services? I don't know. Maybe if we had universal housing, maybe if we had people had food to eat, maybe if SNAP didn't get cut, maybe then we wouldn't have so many people that needed services. Where is the more, I hope there's a board or something that's doing some more upstream intervention, but this feels it just feels really like this.
Well, and it's also maybe
I'm
part of our
off my
response
soapbox.
should remind them that Oregon is at the lowest, what are we, 48th in the state for access to substance use treatment? I mean, it's no
Yeah.
wonder, right? And also, if they keep underfunding higher ed, we're not going to solve the behavioral health workforce crisis because people can't afford to go get the degrees that then get them a license that then allow them to serve the community.
So I want to bring us back a little because we're at 4 and I don't know what everyone's time is looking like. I know that Troy had mentioned something about doing some work when he wasn't in this meeting. So I'm going to propose, I think it might be a good idea to talk about a follow-up meeting, possibly even after we think, and I don't have any, Troy would know more about this than me, when we think the LC might become a bill. So number 1, and then number 2, if you all want some type of a response, I mean, yeah, it's, I don't, the board does what the board does. Can you all do a written response? Absolutely. I mean, there's a number of things that you can do as a board because you're a board. So, and that is that is definitely within the realm of responsibilities. And if that is something that you all want to do, how do you all want to go about that? Do you all want to get somebody together, write that? You all want me to assign staff to that kind of thing. So those are my two proposals right now. Next meeting, and then do you all want to write something, or do you all want to do anything? So, thoughts?
I think we should get on getting our office staff unionized so they have a contract and bumping rights.
Can I ask
Yeah.
a question about the relating cause?
Relating?
Yeah,
don't
I
know.
think that Troy was talking about that. I don't know if Troy, again, I don't mean to put you on the spot to answer this,
Oh,
but
yeah.
he was talking about, so, and again, like if the relating clause on this bill is large, and there are lots of ideas in this bill, right? Does this suggestion that they want to do, is there a chance that it could get lost in there? Do you understand? That it could get lost, not seen, and it gets signed off on. If there's a lot of it stuff in there, I'm just
Yeah,
staying still.
no, that's fine.
I don't know if I don't know if I communicated that well or not. I'm sorry, I don't have the language to communicate some of these larger legislative concepts very well.
No problem. I'll see if I respond correctly. If I don't, please redirect. The relating clause in a legislative bill dictates how wide or how narrow the conversation of the law following that opening statement has to follow. So it could be something related to mental health, and that can be
Right.
very, very broad. It could also be related specifically to this board, which
Right.
means
Right.
then it could only do a statute related to this board. There are things what are called omnibus bills, which are extremely very, 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 very broad on purpose
Right.
because the legislature will keep that active and open to stuff anything and everything they can think of into it at the very last minute because it's an omnibus bill. It's purposely very broad for that sole reason. It's the carrier for a lot of different ideas. There are benefits to being very broad in the relating clause. There are benefits to being very narrow. It just depends on what you as the sponsor are trying to achieve. Do you want to keep that very narrow, related to speed limits on I-5, or you want it related to transportation and it's anything and everything? And it's hard to say because we don't have the bill language yet to look at and respond. Can things get lost, overlooked? Can things get
Hidden.
missed if it's in an omnibus bill? Absolutely. I've seen it dozens of times over the past 35 years. But there are also times when a very particular singular focus one item bill never gets any attention because it's just that one sponsor wants it and none of the other legislators, other 89 people want anything to do with it. So I don't know if I've helped, if I answered your question. I apologize if I missed.
Yeah.
So who will sponsor this? Do we know? Like if it's who's gonna sponsor it? Is it gonna be, can the talent, whatever the hell they're called, sponsor it? Or
Is it
how
a
will we know?
legislator?
I will just be saying to you, I think it's a guess on my part. I think it's the governor.
Mm-hmm.
The governor is gonna sponsor it.
Correct. And that you have
Well,
to think
that's the
about that
guess.
too in our role. It's a guess.
Right.
Given the discussion, and I don't know who else sat in on the meeting a couple weeks ago because they didn't have the big list of who all was online listed. But I think I shared with everybody a couple of my thoughts and takeaways. They're throwing acronyms all over the place. So I got spun around multiple times, but it came across to me as if this was going to be a governor's, because it's a governor's task force. The governor's the one that would likely be the sponsor. Could it be also co-sponsored with the legislators? Absolutely. Could be that way too.
So even though we don't quite know who maybe we're responding to, or maybe we do, whether it's right away or we are prepping, I feel like we need to prep something and we need to probably start working on it now. My question to Kim is, how easy is it to pull up some of this information around timelines to licensure, what reciprocity looks like some of that kind of those narrative pieces that the staff might have that have some numbers in them?
Mm-hmm.
We can get that for you right away.
So if you want to craft a response, my recommendation, and of course, once again, Troy probably knows a whole lot more about this than me, but I'm thinking maybe Talent Council would be who we'd send it to. We also have a governor's policy advisor. I can think of 2 of them, even 3 that we could send it to, and that's the short list. We could send it to the first lady, you know, send it to all of them. I don't know. So
Well, I would think that, and I could be wrong on this, because that this concept was emphasized in the governor's letter, I think paragraph 3, right, in that 2-pager, right? So and very clearly, it's in that bottom second paragraph that the Board of Licensed Social Worker will fall underneath that. So I think that signals a strong likelihood that they want to push this proposal through. Right? There's 187 pages of all this other stuff, and then there's 1 paragraph that is quite clear in that 2-pager.
So my other question is about how Box functions, because I'm not as familiar with it. I only use it for board stuff. Kim, can it work like a Google Doc where multiple people can work on the same document together?
I am not sure about that. We can.
Mhm. Yeah, you can.
In
I
Box?
can.
In Box.
Yeah,
as a
in
Google
Box,
Doc.
because that's what
Oh, I
they
see.
use. They're not Google people
Uh-huh.
at the government. So that's why I'm asking is if a document that's added to Box can be made so that multiple people can edit it the way that
I
a Google
actually-
Doc.
I think so, because I think you all
Okay.
have editing rights.
Okay.
You're like at the highest level of your Box
Okay.
membership. So I believe we might be able to do that.
Okay.
I just created a Microsoft document in there called
Okay.
test, and it looks like it does function like a Google Drive that people would be able to go in and edit it. But I don't know, see if other people can go in and edit it, the
Okay.
thing I made.
Yeah.
Did you
So maybe-
share? I think you might have to share it with us first, though.
So my suggestion for kind of a first step would be maybe for Kim, you to pull some numbers and, brief narratives around these kind of key issues. Who's allowed to supervise for how many hours, who's being added, like those pieces, and into a document that we'll just call draft response, and that multiple of us can then, email us when you have that in there, and we can start kind of working on something together. Because I think it will be helpful to have multiple eyes on it. Like,
Oh, for
Olivia,
sure.
I want you to talk about, the upstream stuff. I think we should name that in there, quite honestly. And I think we link it to the higher ed as well. Like, I mean, let's call them out on, the very narrow lens that they're using to look at this issue, but also like the places that they just factually have things wrong as well. And whether or not we get it drafted to send on time, we can still send it out to multiple people, and we could maybe use it if we need to testify or somebody needs to testify as well. But I'm willing to work on on a response for sure.
Me too.
Oh, yeah, Nikki. Looks like Nikki had to leave.
Hey, I'm in your test. I'm trying to figure out if I can write in it though. Oh wait,
Oh, I see your test now.
I can go like this. You see it?
I've got
But-
it open. It just looks blank to me.
Oh,
Maybe you have to save what you're doing first, or
Oh, I see Amy, yeah. When you click on it, there's a little, when you click on it in Box, there's a little icon that says open with a drop down, and then you just say Microsoft Word for Web, open this file in your browser to edit in real time with others.
oh. let's
Yeah.
see.
So it looks like this is an option.
And then
for-
you'll be able to see what I typed.
oh,
in
I
there.
see. I see what Amy typed.
Okay, wait.
So yes, Molly, we can.
Yeah.
Ray, because it is almost 4:15, and I know
Yes.
I gotta drive home, which
Mhm.
is a drive.
Yeah.
Do we want to schedule another meeting, or do we want to kind of hold that in abeyance until we work through a letter? I think we meet in
Well-
February for a regular board meeting
Right.
also.
Well, I don't know that there'd be a whole lot of point to meeting before there's a bill. Once again, Troy would know more about that than me, but that's my assumption. Or unless we just want to meet on the letter. But I don't know that sending a letter is a policy decision, because you can't collaborate on a policy decision. I don't know that responding to a letter is an actual policy decision. I have to check with public meetings law, because you all may not even be able to collaborate on this. But I know that you can't collaborate on a policy decision, and I'm not saying that this is a policy decision, but I'll ask.
Oh, dang.
certainly. So
That's a
We would
good
have
point.
to, we would maybe have to make a committee, right? And
No,
assign
no,
a
you just set up
committee,
another
then we can
meeting.
work together?
Or
Okay,
it
Well,
could
yeah,
just be
well, you could have a
three
committee,
board
yes.
members or less.
Right. Or you could do that. Yes. Absolutely.
okay.
So it sounds like maybe we'll just hold it in abeyance until we find out kind of. Ray, you'll find out about the letter.
Yeah, I
Is
could
this
let you know
something we can do?
tomorrow
And then-
whether or
okay.
not that's a violation of public meetings law.
Okay,
But I know,
Well-
like, but to Molly's point, if you all created a committee, then you all could collaborate as a committee. So whoever's writing it, I guess. So anyway. All right. So then, as far as so let's talk about this. So we're talking about the letter. I'll find out from the Ethics Commission if you all can collaborate on a letter, and then if so, I'll send that out. I'll know that by tomorrow. I can send that out in the email so you all can know, and then you all can collaborate on that. If not, then I'll send out instructions for what you all can do and still be compliant to public meetings law. So that's the first thing. Second thing, as far as setting up a follow-up meeting, I think probably at this point, even coming up with a date might be a bit premature. So I think what would make the most sense, and Troy, I would love for you to chime in on this, would be to wait until we have some idea of when there's an actual bill, and then schedule something around that, if not just meeting in February. So.
And I can share with you, I'm sorry, I'm looking at a different screen, working off the laptop, but the 2026 legislative session deadline calendar shows that there will be what is called legislative days. So the full 90 members will be in Salem January 13, 14,
Oh, that's next week.
and
Okay.
15.
Okay.
When they are there, they're dealing with legislative side potential proposals, particularly by individual committees. So it's possible that this concept, if a legislator or legislators broadly are interested in this could pop up in the 13th, 14th, and 15th, and in the meeting, it then becomes public.
Oh,
Friday,
okay.
Friday the 16th is what's called the drop deadline, which means that whoever, like statewide elected officials and legislators or legislative committees, by the 16th have to have into the system to the legislative council what they are intending, their
Okay.
thought, their concept is due by the 16th to make it into that particular hoop. Then everything sits in the background and gets worked
Right.
on.
Exactly.
The legislature comes into session on Monday, February 2nd. And that is when bills then very quickly, it's just a short session, typically the first day or two, the Senate and the House, both of those chambers announce what the slate of bills that are going to be active with House bill numbers and Senate bill numbers that'll be active over the next five and a half weeks during the legislative session. There are deadlines then in that 5.5 weeks to say when bills have to be worked in the House or worked in the Senate, finished, and then shipped over to the other chamber and worked and shipped back. There are certain deadlines that follow over those next 5 weeks because it's very, very, very fast. And so if I was to say to predict the latest that if a bill is going to come forward, it's going to include some of this language as mentioned that we've been talking about for the last hour or so. The latest that likely will be public and available under bill name will probably be Wednesday, February 4th.
Okay.
But know that the first chamber, if it starts in the Senate or it starts in the House, the first chamber is going to have to bring the bill up. take testimony and vote on it by the first deadline of being Monday, February 16th. That's the deadline of when they've got to have it done in the first chamber, wherever it starts, before it crosses over to the other chamber. So that's a very quick little window. That's and
So
that
you're saying if it's not done by then it's not going to be done?
Well, a great question, Patty, that if the first chamber has not moved it by the 9th, there are still some lifelines where bills can be brought forward. Some things if it's stuffed into an omnibus bill, as we talked about earlier, that stays alive all the way to the very end. That sometimes you hear people call it the Christmas tree bill, where everything gets into it. That there's the potential that the language of that bill could be pulled out and moved over into an omnibus bill that's still alive, clear to the end, or it could be picked up and moved into a bill that's not related to behavioral health, but related to behavioral health, not related to this board specifically, because it's broader. The narrow language can be copied and pasted and shoved into that broader language bill as well. So I will just tell you can't say the bill's dead just because it missed the February 9th cutoff. Its chances of survival becomes much fewer. There's harder pathways to get through, but it's really alive literally until they gavel sine die at the very end. Everything they want to think about can be brought in one way or another all the way till that very last day. So Patty, sorry if I went in circles, I apologize. And I'm not looking at you all at the screen. I'm looking at my calendar screen, so I'll shift back over. That's my fault. I should be looking at you all. So,
but the short version of that is so we when session hits, we monitor for bills regularly, every single I think about every single day to see what's going to happen. So the short summarization from Troy's presentation is we can keep an eye on what's going on in the legislature, and we'll have a really good idea of if that bill releases, when it releases, and what it says, and we'll be able to let you all know that. So I guess
I was just looking because the LC drop deadline, Troy, is January 16th. So
that's to get it to what's they're called, to the council, legislative council, right? It's not to get out of there. It's going in.
And it's also for council to have their work done so that the legislative body can consider whether they're going to hear it or not. And again, it's attorney-client privilege.
Right, that's not public.
Just because there's a deadline doesn't mean you're going to get to see it unless the sponsor says that it's okay to release.
So with that said, I'm not even going to try to sit here and say that I can have somebody monitor legislators to see what happens, because we just don't have that kind of bandwidth. But I mean, if I can get some assistance from whoever to monitor ledge days, because you're saying, Troy, that it could pop up during ledge days, right? One of us would have to, or someone would have to be there to monitor that to see what happens. And I guess we can figure out how to use OLIS. You all have access to OLIS. I'll put that. Well, actually, I can't get to my chat. So, but maybe Kim, can you put like OLIS in the chat so that they at least know what that is? And if you
Just
go
the
into
general OLIS website.
Yeah, well, if you have the website, or you can just put OLIS in there, because if you put that in Google, it'll direct you straight to OLIS.
I'm on it.
Yeah, and that's what we use. We use OLIS to monitor bills. It's public. You all can use that too. No, actually, we use something else, right? Can we use? Yeah, I don't think they have access to what we use.
We use Bill Tracker and OLIS.
Yeah, but they don't have access to Bill Tracker.
No.
But we have a tool that helps us keep updated on what bills are going to be released. You all can also use OLIS to take a look and see what's going on in there. And then we could, I guess, as far as monitoring ledge days, we would need help with that. I don't have the bandwidth, and I know our staff don't have the bandwidth to monitor ledge days. We just can't. So you all as board members can work that out. Once again, I don't see that being as a policy decision. So what you all choosing to monitor OLIS or not and doing that on your own time, that's got nothing to do with me. So anyway, so I guess that's where we are. So we'll monitor, we'll use our tools to see what we can do to come up with if that bill drops. You all can use your access to OLIS to communicate with one another, because that's all public information to let people know what you come up with. And then as far as that's what I said, just said ledge days. And then I'll find out from the Ethics Commission if you all can collaborate on a document to respond. And you all can certainly do that. I mean, I shouldn't say that, but the board can create a document. How you do that is a whole other story. But the board can certainly create a document and send it. I mean, that's certainly an option you can use. So we're talking about the how. And so I'll talk to the Ethics Commission and see if you all can collaborate. If you can't, then you all can figure out how best you all want to do that. So and I think that's all I have. Is there anything else before we close? Okay, I think a board member has to do the thing.
Oh, well, we can just adjourn. We don't have to vote on adjourning.
Okay, awesome.
But we
Okay.
definitely at 4:26 can be done and adjourn.
Okay, all right. Thanks, everyone.
Thanks,
Thank
y'all.
you.
Bye, you all. Good to see you.
Bye.
Bye. Oh boy.